Hi, my name is Cyrus Yazdi. I'm a pain physician and welcome to my YouTube channel, Ask Your Pain Doc. By the way, Happy New Year, Happy Holidays, Merry Christmas, and thank God 2020 is gone, poof in the air. And I'm really looking forward. Great year with a lot of good news and a lot of health, and hopefully vaccine will be everywhere and everybody feel better. Today we have a very exciting topic. We're going to talk about sciatica, or this radiating pain that everybody talks about it. What can we do about it? I'm pretty sure it happened to you or your family. Severe back pains after you lift something, or you were in gym doing exercise, you feel like an electrical shooting pain, or some people describe that as like a dull aching pain that goes down to your leg. So today we're going to talk about that, what it is, what is disc herniation, what shall we do about it, and all type of treatments are available. Depending on the level that nerve is compressed, your pain may get worse after lifting, bending, turning, twisting, and coughing. As you may know, sciatic nerve is the biggest nerve in your body. It starts from your lower back area and goes down to your feet. So what are the typical symptoms? Typical symptoms usually start by a severe low back pain that travels down to your legs, most of the time one leg. People describe that as dull, achy, shooting, burning, stabbing pain that travels down to your buttocks area and goes all the way down to your leg. Some people describe that as pins and needles, and something in my field they call it the neuropathic pain. Depending on the level that nerve is compressed, your pain may get worse after lifting, bending, turning, twisting, and coughing. 90% of sciatica is because of disc herniation. So what is disc herniation? You can see in this video the gap between the two bones in the spines are filled with disc. And disc is consistent of two parts, the central gelatinous material and also a fibrinous rim. As over time, as you can see, if the gelatinous material are pushed through the backside of the disc, this is what we call a disc herniation. As I explained, the jelly that kind of pushes through the donut and push and press on the nerve. If that jelly press on the nerve, then that will cause severe radiating pain that is sharp and stabbing down lower extremity. There are also other conditions like spinal stenosis, tumor, and infection that can present like sciatica. Sciatica usually goes away by itself in few hours or few days, so don't worry, it will get better on its own. You just need to rest. But there's some attacks that it may last for a few weeks or few months. So what we usually gonna do? How are we gonna find out if this is a disc herniation or not? Usually if you have this type of pain more than 4 to 6 weeks and you feel that your pain is getting worse, and or if you have weakness in your legs, that's the time to see a primary care doctor. Usually after these, there would be some type of advanced imaging, including MRI or CT scan, and we will be able to find that disc herniation. So how are we going to treat that? First, we're just going to start some medication and give it some time to heal. Usually we start with over-the-counter medication like aspirin, Tylenol, Aleve. If you have severe muscle spasm, muscle relaxant may help. Other alternative treatments like physical therapy, massage, ultrasound therapy, heat and cold may help you to bring down the pain and inflammation. Patients, they had severe pain that does not respond to physical therapy or medication. Those patients we usually consider doing epidural steroid injection. What steroid does is bring down the inflammation around the disc area and in some patients significantly help him for a few days to a few weeks. The last option will be having surgery, and we'll try to prevent that as much as possible. We save surgery for severe pain. The patient has severe weakness, and if obviously does not respond to any type of conservative treatments. One of the questions that my patients ask me when they recover from an episode of severe sciatica, what they have to do so this won't happen again. There are a few things that they have to consider. If you're really heavy and that can put a lot of pressure on your back, you have to lose weight. I know it's not easy. Don't lift anything heavy. Good posture is very important. You have to make sure you strengthen your core muscle, your abdominal wall muscle, and your paraspinal muscle. Good exercise helps. If you're smoking, you have to quit smoking. What nicotine does, it will weaken the bone, and it also weakens the cartilage. And if you have a weak bone and cartilage, this will happen. Thank you for watching. Please send me your feedback and comments. Stay tuned for our next video. In our next video, we're going to talk about spinal stenosis. It's very common, and we're going to talk about how to treat it, how to diagnose it, and what are the symptoms. Stay tuned, and I will see you soon.